Before burnout, there is work fatigue. Work fatigue is a chronic job stress that has begun affecting the worker mentally, emotionally, physically, ethically, and spiritually. It often appears before disease fully manifests. That is why workers may present to the doctor with real symptoms and still leave feeling dismissed, confused, and unseen. The issue is not always that the doctor ignored them. Doctors are positioned for diagnosis, treatment, and disease management. Workforce care is designed for prevention, assessment, system navigation, and work context clarity before stress becomes disease, crises, or workforce loss. Hi, my name is Glennae Davis. I am the founder and CEO at Glennae's RX for Life. We are a career burnout consultancy and healthcare education agency. We specialize in workplace mental health, specifically for Black career women and registered nurses whose unique roles in workplaces absolutely deserve specialized knowledge, understanding, and application so that they return to work better. In this video, I want to talk to you about what's happening when work is the reason for you breaking down. Work is the reason you're breaking down. Okay, so black black women and RNs are doing a job of 2 to 5 people. This is what I hear. This is what I've experienced when I have done travel assignments, being the only registered nurse running an EP lab or a cath lab for a 12-hour shift. I couldn't imagine doing that full time for an extended period of time just because they can get away with it. So I know that nurses and Black career women are working short staff. Organizations are operating, meeting deadlines and financial goals using less staff. So if they're getting away with it and it's working and there's no problem, there's nothing to fix. However, are you carrying a whole unit, a whole department on your back? Have you been vocal about it? Are you having water cooler talks with your colleagues and your coworkers saying what the problem is, but yet not doing anything to fix it? Have you been trying to manage your high blood pressure, chronic pain, cynicism, chronic stress, but fear putting your own need above the needs of the hospital? Well, this video is for you today. Questions I would ask you if you were to come into the Workforce Care Center, complete our work fatigue quiz before taking FMLA is, if it weren't for the added pressure at work you're facing, would your blood pressure be high? Would you have high blood pressure? Would you be living under chronic stress? Would you be applying the extra pressure on yourself by taking blood pressure medications? Because taking blood pressure medicines is not benign. Every pill that you put in your mouth is going to come with some side effect. And in case you don't know, side effects are an indication of an injury to your organ, to a organ, to something in your body. So some people are already dealing with the stress and then they get, you know, foggy, brain fogged about where the dizziness is coming from, the extra fatigue, tiredness and sleepiness, the nausea. So therefore you're increasing your caffeine intake, increasing your heart rate. There is a whole lot going on with you, all because you're working short staffed, you're talking about it to your colleagues, but then you're not approaching the management with what it is that you absolutely should be doing so that work is not wearing you down. They're going to get away with whatever you allow them to get away with. They're going to do whatever it is that they have been doing. They have figured out how to finesse the system. And about these blood pressure medications, if you're Black, some first line, first try blood pressure medications like ACE inhibitors can cause you to develop angioedema. But yet, it's the ACE inhibitor is the first line of blood pressure medications. But for you, your blood pressure may absolutely be high because of the chronic stress. Remember, we define chronic stress as any job stress that's lasting longer than 6 weeks and it hasn't resolved on its own. For you, there's a significant risk here for burnout. Burnout means here at Workforce Care Center that you're taking medications to work under pressure. You're taking medications to tolerate the oppression. You're taking these medications to make you, you know, be mindful of what's going on, but then not make any moves that's going to risk you maybe losing that job, which is a really bad position to be in. So let me repeat that. When you're taking medications for issues that causes work, that for issues that's caused by work that arose from the workplace, that arise from the workplace, chronic job stress lasting longer than 6 weeks, it has not resolved on its own. When you begin to take medication to keep that job, take medication to continue to work, what you're essentially doing is taking medication so that you can continue to work under pressure, so that you can continue to work and tolerate the oppression. We want to help you lift that oppression, access your rights, so that you can take the time off that you need, assess the situation, and return back to work better. We want to help you to make better real time, real world workplace decisions. We believe your bottom line as a Black career woman and as a registered nurse is as significant, if not more significant, than your employer's bottom line. Because currently, without our workforce care center, institutions recover. Black career women and registered nurses are finding it difficult to recover the experience that they are having in the workplace. So the organization continues on, but the people fall bottom, fall what word am I looking for? Fall downstream. We want to help keep you upstream so that you can conduct the business that you should be conducting, take the time off, access your rights, return to work without ever losing a step. It's possible. And currently, workforce care institutions, where am I at? Oh, like, okay, that's what I said. Institutions do recover, but Black career women and RNs are finding it difficult to return to work after burnout. So workers are taking FMLA. They're getting their FMLA paper signed for mental health, manifested by job stress lasting longer than 6 weeks, somehow are being ignored in the system and becoming patients. How did you become a patient? Because you're dealing with workplace issues. What is the correlation there? How did you become a patient with diagnoses and prescriptions just because you're having workplace issues? We want to fix that for you. And then you try to return to work, but you got a disability, and your doctor, your provider is like, well, your organization, your employer, is supposed to do the ADA accommodation for you. But why are you going back to work disabled? Something's happening within that 12 weeks that is injuring Black career women and registered nurses and preventing them from going back to work, increasing turnover. So when Black career women take off on FMLA for workplace issues causing serious health conditions, why is workplace issues causing serious health conditions? Could be because you're not addressing the situation in real time and allowing for that oppression and that oppression and that depression. Depression and oppression are the exact same words, the exact same words, the exact same meaning. Depression and oppression is happening in the workplace. But instead of someone lifting the problem off of you, they're suppressing the pressure so that you can tolerate the abuse. Okay, so when workplace issues are causing serious health conditions, workforce care is imperative for you to provide, for you to have the leadership to prevent burnout and disability. We're asking that if you are experiencing workplace stress, that could be discrimination. Discrimination is one of the most severest forms of chronic job stress known to the Black community, and it causes a plethora of preventable stress related diseases. Registered nurses are also carrying entire industries and systems on their back, not able to take care of themselves, but actually expected to perform for their patients. This is a patient safety issue. We want to help you take your time off, boldly and empowered confront your situation so that you preserve your employability, your dignity. You do not become a patient just because you're dealing with workplace issues. So thanks for coming to my TED Talk today. Take our work fatigue quiz, okay? It is the only way that you are going to be able to connect with our workforce care specialist, get you on the right road to rest and recovery. All right, you guys, have a great day. Leave questions, comments, share, and like this post. Help get this reach. This is the gospel. We are spreading the word. Talk to you next time. Bye.